What's up, what's up, what's up? Jenelise 2007, 007. I'm sorry I changed that. I am coming to you this morning with a rhinoplasty vlog. I recently just had rhinoplasty about 11 days ago. And I was suffering from something called a deviated septum. A deviated septum consists of something that causes a blockage on either side of your nostril in your septum. Mine was shaped in an S, so it was very hard for me to breathe. I had a lot of sinus problems. I had runny nose, stuffy nose, just everything you can think of. So I got it fixed, and while they were up there, then I wanted to make sure that the nares, these things right here are called your nares. A lot of ethnic people, Dominican, black, Puerto Ricans, whatever you are, we tend to have a larger nostril frame at the bottom and tends to widen and flare like that. Yeah, so I had them fixed that, so if you can see now it's a little bit more slender, and my profile is really nice. Same profile, I just basically got that other thing fixed, and I can breathe a whole lot better. First couple days is like absolute hell. You cannot breathe for nothing. It feels like somebody's been jamming something up in your scalp. Just, I don't know, I had bumps and bruises all up here. It was just horrible. But the whole point of that is because they're actually going in there with these little tools to break up the part of the bone that's causing you the problem, which is the deviated septum. And then they take that out, and then they have to put something down that almost looks like a screwdriver, and they go all the way down your nostril to the back where your sinuses and stuff are, and they make sure that's clear. So they're kind of jabbing around in there to make sure that there's no extra blockage. And the doctor that I went to was in San Diego, California, inside Coronado, and he doesn't use packing or anything. Sometimes the day that you leave the hospital, you'll have packing in your nose. It's like 3 feet of packing to catch all the fragments and bone and blood and all that other stuff. He doesn't do that. He just puts a nice little bandage across your face, and he puts something under here so that you won't drip everywhere. People that have a hump on their nose, sometimes people have a little dorsal hump on the top of your nose, that's when you get a splint. And they put a splint across your nose, which is like a little miniature cast, and that stays on there for about a week, just so that your bones and stuff can set in place and the soft pliable tissue gets a chance to fuse back together, and you don't get a chance to distort it. So I didn't have that done, but if you're thinking about a rhinoplasty and you have a dorsal hump, then that's one of the possibilities that your surgeon might choose for you. So I'm about 11 days post-op. I'm doing great now. For the first couple days, I felt like I had a severe head cold, a lot of pain and pressure in through here. Your eyes tend to be black and blue for the first couple days, and as that dissipates, you tend to turn yellow, almost like a jaundicey color. You have a lot of pain and tension in here. It's almost like your face is stuck up that way. But you heal from the top down. So everything starts up here and it moves downward. And all the pain and pressure and everything, like a sinus infection, tends to dissipate and it goes away. This part of your nose, which is called the bulbous, will tend to be swollen for 6 months to a year. This is the last part of your nose to lose all the swelling. Everything else here tends to go away in about a week or two. This part, you're going to end up with the most of your swelling, majority of your swelling. But after about 2 to 3 months, you should start to see how your nose will take shape. So, all you people who feel like I just paid all this money and my nose isn't the way I want it to be, stay tuned and you'll start to see a change after a couple of months. What else can I tell you about rhinoplasty? It was a very good decision for me. I've been dealing with sinus problems and this breathing problem for a long time. I'm 28 years old, so I think I first noticed the problem when I was about 12. So it was time for me to do it. I was just scared because I didn't want anybody messing with my nose. But it was a very good investment. I can breathe wonderful. I can smell things that I never smelled before. And I'm really happy. So anyone who is interested in rhinoplasty, what I can say is check your surgeon, get references, make sure it's something that you really want to do. Don't rush and just get the first surgeon that you see. Try to find somebody who believes in scarless incisions. There's 2 different types of rhinoplasties you can get. There's an open rhinoplasty where they make an incision here. They actually remove the skin, lift your skin all the way up so that your bones and everything else is visible to your surgeon, and they work from the inside out. Then there's a closed rhinoplasty where they go on the inside of your nostrils. They tend to make small little incisions, and they work from the inside out. So you have to be really alert when it comes to knowing what kind of rhinoplasty you want. And if you happen to be ethnic, it's probably a good thing that you don't get an open rhinoplasty, because we do tend to scar or keloid or something called hypertrophic scarring, which is basically, I don't know if you can see on my arm, let me see. Here on my arm, there's like a little, let's see right here, I don't know if you can see that, you probably can't. But it's almost, it's not a keloid, it's just like a little scar, and it tends to raise a little bit. That's called hypertrophic scarring. And people that are ethnic, Asian, stuff like that, we tend to scar like that sometimes. So it's a good idea not to have, some people get incisions around their nostrils to reduce the size of their nares and stuff like that, but you don't necessarily have to do that. If your surgeon is a good surgeon that's been in practice for a couple years, he can actually go on the inside of your nose and put sutures in there that actually dissolve with your skin so that you don't have to have any outside marks or scars per se. So you really have to check into this stuff. I'm Janet 007. Please rate and subscribe. If you have any questions or commentary, it is very much appreciated. Thank you, and see you next time. Peace.